Today we will be doing catheter care for a male with hand washing. The supplies you need for this skill are 1 bath blanket, 3 washcloths, and gloves. The focus of this skill is to prevent pain and to also prevent infection. Hi, Mr. Henry. My name is Chyna. I'll be your CNA for today, and I'm here to clean your catheter, okay? So the first thing we're going to do is provide privacy for him, and we're going to go ahead and make sure his bed is flat and that he's in supine position. Next, we want to raise the bed to waist level because anytime we're working on a resident or doing anything to them, we want to bring them up to us so that we do not cause strain on our backs. So once we have him raised, we will get our gloves and then we will get our supplies. So for this skill, we do need a basin with water and soap. We need 3 washcloths and a bath blanket. So we'll start with placing our bath blanket on our resident. Once you have that placed, you will roll their covers down. And we want to make sure that we are only exposing the area that we'll be cleaning. So once we have our cover rolled down, we will then take our bath blanket and roll it under our gown. Once we have the area exposed, we want to first check our catheter line all the way down to our drainage bag to make sure there are no leaks or any kinks in the line. So we're going to start with where it's actually exiting the urethra or the penis. We'll start here, and then you can check it one of 2 ways. You can physically just point and check with your finger, starting at the beginning all the way down to the drainage bag without touching. Or the second way is to actually hold the line and then you can grab it and go all the way down with your hand. If you're going to use the second method, make sure you remember to hold it in place before you touch it. That is one of your bold statements for this skill. So after we checked our line, we'll then start with cleaning. Our first towel is going to be our wash towel. So we're going to use soap and water. We'll get some water. We have our 4 leaves. So we're going to put soap on each leaf. So the first leaf we're going to use to clean where it actually exits the urethra. We're just going to hold it in place right here and wipe around. And then we'll fold that down. Secondly, we have to hold the tubing, and then we go down 3 to 4 inches away from where it exits. Fold that down, hold it again, clean 3 to 4 inches, and lastly, clean 3 to 4 inches away from the exiting point. We'll put this towel in our hamper. The second towel we use to just rinse with water. We're going to rinse where it exits the head of the penis again. We'll hold it right there, clean. Second leaf, we're going to hold our tubing and rinse 3 to 4 inches. Third leaf, hold the tubing, rinse 3 to 4 inches. Last leaf, hold the tubing, rinse 3 to 4 inches. We'll discard that entire hamper, and our last towel we're going to use to pat dry. We're going to pat dry where it exits, and then we will hold it again, pat dry 3 to 4 inches, hold it again, pat dry 3 to 4 inches, hold it again, pat dry. We'll discard this entire hamper. Now we're done cleaning, so we're going to roll our bath blanket and gown back down, and then we'll just pull their cover up as we take our bath blanket away. We'll discard this entire hamper. Now we have to rinse and dry our material, so we will pour out our water and take a paper towel and dry our basin out. Next, we'll take our soap and put it back up into storage. We'll discard our paper towel in the trash and remove our gloves. So we're going to remove by pinching the first glove, pulling it down, taking 2 fingers, and taking off the second one. Once you have your gloves off, you want to let your patient or your resident back down. And if they want to sit up, you can leave them sitting up. Once you let them down, you want to remove your privacy curtain, and then we always give them their collar light or place it in easy reach for them to get, and ask them if they need anything. And then we will go wash our hands with soap and water. So we're going to do hand washing now. We want to make sure that we do not touch the sink with our uniform. We want to cut the water on, and we want to make sure our fingertips are pointed downward. Get soap. And as we wash, our fingertips are still pointed downward as we lather our hands. When washing, you want to make sure you wash each individual finger. You want to make sure you interlock or interlace your fingers. We want to make sure we wash our wrists, still with our hands pointed downward. And we want to make sure we clean under our nails by going in a circular motion in the palm of our hands. And we know we have to hand wash for at least 20 seconds. So once we're done, we'll rinse, still with our fingertips pointed downward. Once we're done washing, we'll grab a paper towel, dry our hands, discard, and then our last paper towel we'll take to turn our faucet off. Discard.